Dr. David Myers, Utah Valley Dermatology. So dermatitis is inflamed skin. There's really three main types of dermatitis. There is going to be a fourth I'll talk about, but three main ones. Atopic dermatitis, which is eczema, irritant contact dermatitis, and allergic contact dermatitis, which for instance would be poison ivy or nickel allergy. Or seborrheic dermatitis, which is dermatitis in the oily parts of the body. So atopic dermatitis or eczema are very common, especially in little kids with a family history. And it is a combination of environmental factors and genetics. When those two things combine, you can get itchy. We call it the itch that rashes. And you have these in the crooks of the elbows or the backs of the knees. And you can have it lots of the place. You can have eyelids, you can have face, you can have neck, you can have whole body involvement. And again, this has a genetic component, but allergens in the environment can kick it off and it can keep going. Most people kind of grow out of it over the first couple years of life, but a lot of people, it persists and it is incredibly itchy and it affects people's lives a lot. So I love treating it. It's challenging, but there's a lot of cool treatments out there. The next one is irritant contact dermatitis. Irritant contact dermatitis is what we think of when you get really dry hands in the winter from washing your hands a ton. You can get irritant contact dermatitis tons of different ways. Maybe from the type of work that you use, especially if you're using solvents or liquids or waters. That type of irritation can cause dryness on your hands, it can dryness on your legs, feet, other areas, but that's called irritant contact dermatitis. So while eczema, it does help to kind of use a steroid in combination with your moisturizers. For irritant contact, steroids don't help. You really just need to replenish the skin barrier, and you do that with emollients. You do that with lotions and creams and even ointments. So the last couple are allergic contact dermatitis. Allergic contact dermatitis is when you come in contact with something that you're allergic to. It's much less common than the first two, atopic and irritant contact, but it can be very severe. It can last weeks and weeks. And if for some people who get exposed to the allergen, it can last even way longer. So allergic contact dermatitis stimulates a different portion of your immune system. It's delayed. While irritant contact could come on immediately, allergic contact is delayed by 2 to 7 days. Depends if it's the first time that you encounter this allergen you're allergic to or a latter time. So it's kind of a delayed response, but it's more durable. It kind of lasts longer. And these are incredibly itchy and they're more challenging to treat. And a lot of times we use topical or even like intramuscular, like a shot, like an allergy shot, to help calm these down until your body recovers from this rash and settles down on its own. That last one, the seborrheic dermatitis, is actually caused by a commensal yeast that kind of lives in these oily areas of the body, and it is mostly called dandruff. So the uninflamed form of seborrheic dermatitis is dandruff. And so you can have kind of red or little scaly patches, depends on how severe it is. But we see this quite often in the scalp and then occasionally in the facial areas, like it could be in between the eyebrows and even on the central chest in rare cases. And that's treated with topical anti-yeast medicines or shampoos. So anti-dandruff shampoos are amazing to treat this. They're not as strong, but they're easy and everybody can get them and they treat it pretty quick. We even sometimes use an oral anti-yeast medicine intermittently, and that can kind of get a big boost to take care of this problem. So that is your summary of the four most common types of dermatitis that we see. Hope it helps. Thanks for watching. Come back and watch again.